family-centered nursing assessment. As a nurse, what are we assessing? One of the first things we ask about is the family structure. One of the common tools that we use is a genogram. This is an example of a genogram. As you can see, it's very similar to a family tree. We also ask about the family's characteristics and dynamics. Finding out about relationships and care companionships can provide insight into how the family functions. For example, asking how many people live at home with them. They could have 3 generations under one roof. We also ask about socioeconomic status and cultural characteristics, such as household income, or we inquire about memberships to cultural groups such as churches or particular clubs. We want to ask about any current supports and support networks. A great tool that you can use is known as an eco map, which you will be going through in class, or there is a great link below in the comments section. As nurses, we want to find out about their home environment, any issues of security such as temporary accommodation. Then we want to ask about individual health status for each family member, so their physical health. Does anyone suffer a debilitating illness that restricts their mobility? Or does anyone have cardiovascular disease and need 6 monthly echocardiograms? One of the most important things to assess is their beliefs towards or current engagement in health promotion strategies. As the registered nurse, you could make 100 referrals to services. However, if the family doesn't believe or want to access them, they simply won't. It's about finding out what they want and making informed decisions about their health journey. Leading on from that, why are we asking these things? Why don't we just refer person and their family to the same services we did the last person and the last family? Because we aren't all the same. And as the registered nurse, we are a complete outsider. We need to ask to gain insight into the family's world. We need to see the big picture, the holistic view of them and their environment. Also, to know where someone is at. So identifying their baseline, we are able to identify areas of need or concern. As nurses, communication skills can be very important when performing a family-centered assessment. Open body language, non-judgmental tone, eye contact if culturally appropriate, and open-ended questions. We need to think about the environment that we're performing our assessments in and make any modifications when and if at all possible, such as removing any excess noise. However, this can be difficult as often it's the children that are making the noise. Another consideration when thinking about where you're performing your nursing assessments is to think if you can do it in the person's own home, for they will be more comfortable and therefore may increase their disclosure. You want to make sure that you're allocating and permitting enough time. If the nurse is rushed, the person being assessed is going to feel that maybe they're unable to share, they're less likely to engage with the assessment and any aftercare. One commonly used tool is the Calgary Family Assessment Tool. It's a comprehensive assessment tool that establishes a therapeutic conversation, listens to the families, and understands their needs.